I reviewed my patient's chart and medical history. I'm going to go ahead and knock on his door, provide privacy, hand hygiene, and then I'm going to introduce myself. Hi, I'm Sarah, and I'll be your student nurse today. May I have your name and date of birth? All right, so this is Teddy Bear 9/1991. My patient's been verified. So I'm here to do a head-to-toe assessment on you today. I'm just going to check out your body systems and make sure you're doing okay. Do you have any questions for me? All right, are you ready to get started? He said yes. All right, so first I am going to just check my patient's vitals. So I'm going to go ahead and put this thermometer under your tongue, and we're going to wait for the beep. So 97.1, that's good. I'm going to go ahead and check my patient's radial pulse and just watch his respirations as well so that he doesn't know that I'm watching him breathe, so it doesn't alter my findings. So I do that for a full minute. I get 60 beats per minute and 20 for his respiration. So that's good. I can go ahead and do his blood pressure. So I'm just going to make sure this is around his arm, nice and snug, that I have the appropriate size for him. And then I'm also going to take my stethoscope and just listen at that artery. And I can ask him, what are your normal blood pressure findings? He's told me 120/80, so I'm going to go ahead and turn the dial to the right, pump it up to about 150. And as soon as I hear that first sound, that's going to be my systolic. Continue to keep releasing, and that last sound will be my diastolic. So I did get 120/80. I can also check his oxygen saturation. That's at 99% on room air. And I can ask his pain level. Mr. Bear, are you in any pain today, from 0 being no pain at all and 10 being the most pain you've ever felt? So Mr. Bear has said 0, so that's good. I can go ahead and check my patient's level of consciousness by asking him a few questions. Mr. Bear, do you know what day it is? Sunday, very good. Do you know where you are right now? Fresno. And do you know who the president is? Trump, very good. So my patient is responding appropriately. He's oriented to time, place, and situation. His speech is good. It's not slurred, so I don't feel that I need to do a mini mental status examination right now. I can then go ahead and look at my patient's overall appearance. His skin color is appropriate for ethnicity. Could palpate his skin. It's warm and dry to the touch. I can go ahead and look at his fingernails. They're clean. There's no clubbing. He has no jugular vein distension, no edema. I can look throughout his hair. It's distributed evenly, no lesions, no cuts, no pests, so that's good. I can then go ahead and look at his eyes. His sclera is white. I can have you look up for me. I'm just going to check your conjunctiva. It's nice and pink and moist. That's good. And then we're just going to go ahead and look in your nose. And that's nice and moist. Very good. And I can go ahead and check your mouth. So your mouth is nice and moist, no cracking, no inflammation of the gums. All the teeth are intact. His tonsils look good. And then I can also use the tongue depressor and have you say ah, noting the rise of the uvula. I can gently tap back and check his gag reflex, and that was good. And then can I just have you put out your tongue and move it side to side? All right, no tremors. I can also look at his ears, and if there's any tenderness or any lesions, that can happen if he had oxygen tubing. He has no tenderness, no redness, no oxygen tubing. I can look if he has any other tubing throughout, but he has no IV lines, no tubing. If he did have tubing, I just make sure that it's working properly. If he needs a dressing change, to just plan that in my day. But again, no tubing, he's good. And then I can go ahead and look at his overall head and neck. So I can do your facial nerve. So go ahead and squeeze your eyes real tight for me and smile real big and puff out your cheeks. All right, so bilateral symmetry. And then I can go ahead and feel his lymph nodes. It's not swollen. I'm just gonna have you clench down for me and check your temporomandibular joint. And that that muscle strength is symmetrical bilaterally. I'm also going to check your carotid pulses bilaterally. I'm going to make sure to do it separately though. And those are 2+. So that's good. And then we can also check your accessory nerve. Can you put your head up, down, side to side, push against my resistance? Very good. So that's good. And then we can go ahead and move to his respiratory. And I'm just looking at his chest. His inspiration and expiration is relaxed, no labored breathing. So that's good. I can also palpate. So I'm just going with the expansion and making sure that my thumbs are coming together symmetrically bilaterally. So that's good. And then I can go ahead and listen. So on the front, I'm going to be listening in 10 spots since we're checking lungs bilaterally. And then 18 spots in the back. All right, and when I've done that, I'm noting that there's no crackles, no wheezing. Respiratory is good. And then I can go ahead and move to cardiac. So again, just inspecting his chest. Skin is intact. I can palpate his precordium. There's no thrills. And then I can auscultate his heart as well. So I'm going to be using my diaphragm at the aortic, and then at pulmonic, Erb's point, tricuspid, and mitral. So I've heard S1 and S2, and I can also stop here at mitral and take an apical pulse for a full minute. So I've done that, and it's at 60. And I'm going to go ahead and go backwards in those 5 spots with my bell. And I'm just listening for any extra heart sounds, but I did not hear any murmurs or extra heart sounds on my assessment. Then I can go ahead and move to his abdomen. So I'm just going to have him lay back and inspect his abdomen. It is contour is flat, symmetrical, no bulging. Then I can go ahead and percuss in all 4 quadrants. So I'm going to put my non-dominant and then my dominant. With the middle finger, I'm just going to percuss, gently tap the non-dominant middle finger. I've heard tympani throughout in all 4 quadrants. And then I can auscultate in all 4 quadrants. I'm just going to start at the right lower with my diaphragm. I'm going to listen there. Go clockwise. So I've done that, and I've heard normal bowel sounds throughout. If I heard any abnormalities, I'd have to stay in that quadrant for a full 5 minutes, and then I could say if it's hypo or hyperactive. And I'm also going to do light palpation. So I've done that, and there's no tenderness. And then I would just let him know, Mr. Bear, I'm going to go ahead and look at your urinary system. I'll make sure to keep you draped and just protect your privacy, okay? But we're going to go ahead and look down there and look at the urethral meatus. There's no redness, no swelling, and it's good. I would also check if he had a Foley catheter just to make sure that that's intact and that it's working properly. He does not have a Foley catheter. He told me that he's been able to urinate without any difficulty or pain, so that's good. And then I'm just going to have him do a few more neurological tests with me. I can do the rapid alternating movements with you, so go ahead and do what I do with my hands, and he's done that with good coordination. And then I can also have him just sit on the side of the bed. I'm going to tap his knee and check those reflexes. They were nice and brisk. And I can have him stand up, and the bed is behind you, so in case you feel like you're going to fall, just let me know. But I'm going to have you stand, put your palms up, and close your eyes. And he's done that with no swaying, so he has a negative Romberg test. If I wanted to check his mobility and gait, I could also have him stand up and take a short walk with me and just check if he's able to do that without dizziness or if he needs any assistive device. But he's good, and I'm gonna make sure he's back in bed, nice and safe. Pull up his side rails, give him his call light, and I'm gonna move the table in front of him. And Mr. Bear, do you need anything from me right now? Is the temperature good for you? All right, do you need any extra blankets, any ice water? He said he's good. Before I leave, I'm just gonna make sure that the oxygen, suction, ambi bag, they're all in the room, that they're working properly in case something were to happen. And so again, I'm Sarah, and I'm gonna be your student nurse here with you till 7. So if you need anything, you just press the call light, okay? All right, and then I'm just gonna make sure to protect his privacy again, hand hygiene, and then I'm done.